Healthy living doesn't just mean staying active, eating well, and exercising. It also means making sure different parts of our bodies are working properly. Today, Access is launching a series of stories about hearing, how to prevent hearing loss, and different variables that sometimes impact how well a person hears. Today, Dr. Lily Hughes from the Rutland Regional Medical Center joins us for the first of 6 segments.
Hello, my name is Dr. Lily Hughes, and I'm a clinical audiologist at the Ear, Nose, Throat, and Audiology Clinic here at Rutland Regional Medical Center. I'm here to talk to you today about hearing. As an audiologist, I am clinically trained about over 7 to 8 years on the ear and hearing, but I realized just through interactions with patients and through reading different social medias that hearing loss is confusing to people, and a lot of people don't know where to go, don't know what to do when it comes to hearing in general. So today I'm going to start a series of 6 segments on hearing loss. I'm going to start with how the ear works. So to start, I like to talk about sound. You know, sound in our environment is basically created when an object vibrates particles. Those particles vibrate other particles, creating a sound wave. When it gets to our ear, it first reaches the outer ear. The outer ear is almost like a glove. It catches the sound and funnels it down the ear canal. The outer ear is made up of that glove and the funnel, or the pinna and the ear canal. Once it goes to the eardrum, it sets the eardrum into vibration. The eardrum vibrates some tiny bones, actually the smallest bones in the human body, and those bones in turn start a fluid wave in the inner ear. So we have the outer ear, the middle ear, which has the vibratory aspect of sound, and then the inner ear. The inner ear is also known as the cochlea, or a series of fluid-filled tubes that have a lot of really special hair cells in there. Those hair cells vibrate or kind of dance around once that fluid wave goes through. Those hair cells almost look like a piano too. So if I were to take this snail shell shape and fold it out, it would look like a spiral piano. The low pitches are at the very, very top of the ear inside there, and the high pitches are right at the beginning. So right off the bat, when that fluid wave goes in there, it's hitting high pitches and going all the way to low pitches. So if you think about speech as a complex sound, it's hitting a lot of those hair cells in there. Once all of that movement moves the sound to the inner ear, it then starts to send an electrical impulse up to the brain. So we're now moving from the outer ear, middle ear, and inner ear, which is the peripheral hearing system, to the central auditory system, which is our brain. So a myth that I like to bust here is actually that we hear with our brain. Our ear just gets the sound there. So once those electrical impulses get up there, we learn about the timing, the pitch, and the loudness of that sound. So when someone's speaking to me, you know, are they happy? Are they sad? Are they saying a complete sentence or just a couple words? Where is that sound coming from? Our ears also help us localize. Now this is all based on a normal ear. And what's really interesting about the auditory part in the brain is it also helps us with cognition. So the 2 lobes on the side of our heads that help us hear also help us in working memory. So getting short-term to long-term memory. And that's why a lot of research is actually focusing on how is hearing loss affecting our memory. So the ear is pretty amazing. It's also amazing how we are able to measure it. So in our next segment, we're going to be talking about how we measure human hearing.